Hi, welcome back. Today I'm going to talk about being a certified nurse. When you're a nurse, you could get certified in the specialty area you work in. And depending on the area, it tells you how many years you need to be working in that field, when you can take an exam, and what needs to be done prior to taking the exam. My certification is in obstetrics because I have a background in labor and delivery and postpartum. And I decided to take the exam to show that, hey, I wanted to test my knowledge and know if I have a good, solid background in it. And of course I passed, so that's good. For this video, I'm going to show how to navigate through the NCC website, and that's how you get your RNC and OB, or RNC and MNN, or RNC in a different area. But let's go ahead and take a look at the website. So this is where you need to go. You go to nccwebsite.org, and you can tell just by looking at it, it could seem a little overwhelming because there's a lot of boxes everywhere with a lot of information, and you might get a little lost. What you'll do is create your account if you don't have an account yet. If you don't have one, to apply for the exam and find out how you can get certified, go ahead and create your account and it'll let you know what to do. But right over here, apply for exam. These are the certifications that the NCC provides. You can have an inpatient obstetric nursing, that's the one I have. Low risk neonatal intensive care nursing, maternal newborn, neonatal intensive care nursing, and also subspecialties. For me, I'm gonna go ahead and sign in, and here you go. So it says your name on the very top right, and you'll go to home. Right here is my account, your education plans, view your order history, view your CE history, update your profile, modules, and tests. We'll go to the my account. This is the area where you can update your profile. You can also update your work history and when you got your license, and I'll show right there. In this area, you can also print out your certification right here. If you need proof of your certificate, you can go ahead and download it right there. Right here, certification exams. This tells you how to apply for the exam, what's needed, and on the right side, how do I apply? Testing with a proctor, submitting your application, withdrawing your exam, applying for an exam, preview test, program file. This is a lot of good information and resource prior to taking the exam. Continuing education. This is a place where you need to go to when you need to take CE courses to renew your certificate. And right here, inpatient OB is right there, high-risk OB, electronic fetal monitoring, obstetrics for primary care nurse practitioner, and it has a lot of CE modules broken down into different areas. Another area you could go to is browse all modules, and when you browse all the modules, it'll list everything there. It's a lot. And you can also browse the modules by certification and specialty right here. I wanted to show you that depending on the modules you choose, for example, mine is in inpatient obstetric nursing, I can choose all of these to complete my required CEUs to maintain my certification. But you got to realize that depending on the number of hours you choose, it will let you know how much you have to pay for them. So this one's 5 hours, and it costs about $19. And then I'll go back. I'll choose one for 10 hours. Right here, pain of childbirth and its effect on a mother and fetus. It is $29, and something that is, for example, 15 hours, electronic fetal monitoring, it is $39. So it depends on which class you choose or which module you choose, then it'll show you how much it costs. The less hours, the less expensive. The more hours, of course, it's going to be more expensive. This is where I need to go, the maintain your certification, because I've already been certified and I need to maintain it. And this is the confusing part for some people. What you have to do is go to maintain your certification, and it will tell you that you need to complete an assessment. You'll take your assessment right here. Take your assessment and read the instructions, then you'll take your assessment. So just read the instructions on what to do as far as completing your assessment, and you need to take the following to maintain your certificate. So I could click this. The assessment is about 125 multiple choice questions. I have to click the best one. It's timed for 2 hours and 15 minutes. Plan accordingly. And once you hit the begin assessment, it'll take you into the test and you have to go ahead and complete it. This will give us 5 hours of CEUs for taking the exam. So I've already taken the exam, and once you take the exam, what will happen is go to your education plans, and I'm going to show you that I have taken it 3 times already in the past, in 2014, 18, and 20. Let's go and take a look at what happens when you don't study for the exam. After you take the exam, it will show you a specialty index. You have to be in the green and in order for you to pass, and then I was in the red. What I did was just took the exam, didn't even take much interest into it, just click all over the place just to get it over with. And after you complete it, it tells you, guess what? You were green on fetal assessment. Here it is, fetal assessment. I don't have to take any CE modules. But for the next 2, let's see here, 1, 2, 3, 4 sections, 1, 2, 3, 4 up above, it's telling me that I have to take 15 CEs for this, labor and delivery, 10 CEs for pregnancy and obstetric complications, postpartum take 5, newborn take 5. And for the professional practice, it's green and it's 0. So if you got 0, that means that you actually did pretty good on the questions. As a result, I had to take a few CEs, my education plan, in 2018. In 2018, I did the same thing. I just took the assessment, clicked whatever I wanted, and as a result, I got a bunch of reds. So I had to go and pay a bunch of CEs. This one, I actually studied, I took my time answering the questions, and look at what happened. It's all green. This is pretty awesome, huh? So when you look up here, I don't have any hours required because I answered pretty well on the assessment. But there is a baseline of 15 hours that I need to complete. So this is what happens. You have to have a specific number of CEs. And let's look back. I'll give you an example. The last time I took it, it was telling me that I had to take 10 hours under fetal assessment, 15 hours under code 2, 10 hours in code 3. And what I did was, look at this. I took all those courses in order to fulfill the requirement. 10 hours here, 15 hours there, and you get to choose. I mean, it says code 1, 2, 3, 4, 5. You can choose under the continuing education, browse inpatient modules. Here it tells you, you need something in code 1 and you get to choose it. You need something in code 2, you choose it. You need something in code 3, you choose it. And the nice thing is, even though it says 10 hours, you have the ability to choose a topic that interests you. and you can take a class that you want to know, you want to learn about. So right over here for my educational plan, I took the neonatal hypoglycemia and also postpartum hemorrhage strategies for management. Neonatal hypoglycemia, especially with our increasing number of moms with diabetes, they directly affect babies, and the babies could become hypoglycemic, and this was a good article on how to prevent hypoglycemia with the newborns. For the postpartum hemorrhage strategies for management, it talked about postpartum hemorrhage and what kinds of medications are effective and how to prevent the hemorrhage. That is very informative, and that was good to know. And with those classes, of course, it comes with a cost, just to show you. So even though you complete the CEs, you still have to pay a maintenance application. And from what I could see, it was before $60 and now it became $100. So $60 in 2015, $60 in 2018, and now it's $100 in 2021. For this recertification, I did pay a total of $138. Okay, at the end of the assessment, it tells you how many CEs you need to take, and some people were wondering, hey, I've attended a conference, I've attended a class, maybe those CEU classes could fulfill the requirement in the NCC certification. But my issue is that I've heard of people submit their documentation to try to get it approved to fulfill those certification sections, but it was denied, and then as a result they had to just take the course through NCC. For me, I would just rather take the course and know that it will count and I don't have to deal with anything. And after you're done with your education plan, say you complete all the CEs and it shows everything is there, all of these classes will automatically go into the education plan, and once you're done with that, then you can apply to recertify. You'll go ahead and click the button there and continue. It'll show everything. You'll end up paying for the additional maintenance application that was $100, and you will receive an email letting you know that you fulfilled the requirements and get your certificate. So I did that recently. It shows my expiration is now in 2024. Pretty cool, huh? All right. Well, I hope you learned a lot from this short tutorial as far as how to get recertified and completing your RNC certificate requirements. And for those of you who don't have your RNC or certification, I highly encourage you to go ahead and get it done. And you get to test your knowledge. Also, use your education leave at work to help pay for it. Let me know if you have any questions about getting certified in OB. I have a lot of information about that, and I just went through the whole process as far as recertifying. I hope this helps, and if you have any questions, just go ahead and put it in the comment below, and don't forget to like and subscribe. See you later.